Welcome to Focus on the Five, conversations with Baldwin County business leaders and entrepreneurs, brought to you by Josh Knoll of Gulf Coast Financial Advisors. And now, Josh Knoll.
And now, ladies and gentlemen, please welcome Mr. Josh Knoll.
Yep.
Yay!
Woo! You should.
Like
That's how you should do when I walk in the room.
Too good. Too good.
All right, y'all ready?
Yeah.
Yes, sir.
Here we go. Hi, everyone. Welcome to Focus on the Five, conversations with Baldwin County, Alabama area entrepreneurs and business leaders. I'm your host, Josh Knoll of Gulf Coast Financial Advisors. We're coming to you today from the studios of WABF 1480, located here in beautiful downtown Fairhope, Alabama. Now, our regular listeners know our show as a place to give local entrepreneurs and business people here in Baldwin County an opportunity to talk about their products and services and about themselves. Well, today, my very special guest has something a little different to offer. Hope. Hope that there is a helping hand out there for those of us going through financial hardships and needing health care. Hope that the uninsured dealing with health issues can receive high-level professional health care. Hope that they can find a path, a realistic path to healing. So with all that said, please welcome to the show Dr. Robert Lightfoot, the Executive Medical Director of Victory Health Partners. All right.
All right, thank you.
How was that? Was that
Thank you for having
okay?
me. That's good.
Good.
That's good.
All right. So Dr. Lightfoot, I want to jump right in. What is Victory Health Partners?
Victory Health Partners is a faith-based, Christ-centered medical facility. It's located in Mobile, and we've been in existence for 17 years now, going on 18 years. And we provide adult medical care for one group of people, for the low-income, lower-income, uninsured adults, not only in Mobile County, but Baldwin County and 26 counties in Alabama, 11 in Mississippi, and 8 in Florida.
Wow. So what all, when you say adult services or healthcare services for adults, what all services are you referring to?
We are a complete medical facility. We do all adult internal medicine or family practice type medicine. And we also, in the clinic itself, have multiple other specialties that come to the clinic and serve our patients, such as pulmonary, neurology, gynecology, surgeons come. We have counseling, free counseling for patients with licensed counselors. We have an eye clinic. We have a dental clinic that we've started years ago. So it's a little diversified, but it's one-stop shop for medical care.
Well, I have two questions on that. So one, when you referred to lower income and potentially lacking health care, so I'm assuming everything you just described is done in a very affordable manner.
Right. We're not a free clinic. We really look at it as a hand up, not a handout. But our prices are very, very low. A patient, when they get qualified and come in and they're one of our patients, their fee for a visit's $35, $45, $55 for that visit, which pretty much includes almost everything that we do.
Well, and I know we don't want to get into a health insurance discussion, but some of your people that come to see you may have just kind of fallen between the cracks when it comes to coverage.
Yeah, it's, when you think about this is not the homeless. These are not the people under the bridge. These are working people. Somebody in the family's working. They're small business owners. They're construction workers. They're servers. They're hairdressers. They're people that can't afford health insurance privately, and they're in a small business that can't afford group insurance. They don't qualify for Medicaid.
Right.
And they haven't qualified for Medicare yet, so they're in that big gap and they're falling through.
Yeah, they're kind of in that huge chasm there.
Right.
What do they do?
Well, and the numbers in just Mobile and Baldwin County currently are probably a little bit over 100,000 adults. So it's still a huge problem in this area.
That's incredible. All right, so then the second part of that question is, when you listed all those services, do you provide those in one central clinic?
Yes, sir.
Okay.
In one central clinic. We're located off of Downtowner Boulevard in Mobile on Professional Parkway. It's a medical office that we looked at, goodness, 20 years ago, and it was owned by the Infirmary Health Systems, and they had it on the market for $850,000, and we had about $8.50 and a flip phone, and wasn't going into debt, so we prayed for 2 years. And I won't go through the whole story, but God arranged for the Infirmary Health Systems Board unanimously voted to lease that building to us for $1 a year.
$1 a year.
Dollar
To
a
this
year.
day.
To this day.
That's
Amazing.
I paid the first 6 years right off the bat.
well, that left you $2.50.
That's all I had in my pocket at the time.
In that main clinic, then, with all of these doctors that are coming in and the specialists providing the services, they're coming to that central location. Are they doing that for free? As part?
No, we have
Not to the main clinic, but I mean, are they coming in to help you? Yes.
Yeah, they're donating their services.
Donating their time.
These are specialists that come and just give half a day a month, or a day a month, or a couple days a month, or some of them have been coming every week since we opened our doors in 2003.
So you all do your schedule around that availability.
Around that availability.
Right, and you serve more as the general side of that. Is that accurate?
Myself and Dr. Stacy Wing are full-time physicians, and we have volunteer physicians that come. Dr. Sternberg has been with us for years, comes 3 days a week, and Dr. David Pates just recently started volunteering with us. We also have nurse practitioners that come in, and as part of what they do through the University of South Alabama Nursing Department, they come and work with us.
Well, that's all right. So something like Victory Health Partners does not come by accident. Mm-hmm. So let's dive into what the path that led you to this point. What is your background? When did you become a doctor?
I went to University of Alabama, and I won't say the year that I graduated, but it was a long time ago. I've been a doctor for a long time. Actually went to University of Kentucky and did a general surgery residency for 5 years. And then I came back to Mobile in 1986. I went to work with my brother, Dr. William Lightfoot, and doing general surgery. And really what happened was that God took us on a mission trip to Venezuela in March of 1998. And it literally changed our focus. And I loved what I was doing. I loved being in the operating room. I loved doing general surgery. But it was a focus change where we realized, my wife Tammy and I realized, there must be something that we can do here in this area. And then God arranged for us literally to go to a clinic in Montgomery that was very similar, and then to a clinic in Memphis called the Church Health Center that we're actually really modeled after. And when we saw those, it was like a really fuzzy picture got very, very clear, and we knew this is what we're supposed to do.
Before all that went down, I mean, was that the trajectory of your career?
No, I was doing general surgery. I loved doing it.
Okay,
and
so I mean,
this
you're
would
talking
still
about
be happy doing it, but it was a total trajectory change.
But on the trip to Venezuela, your wife and your brother and the whole family was there?
No, just my wife and I went on that trip, and it was the mission trip of all mission trips.
Because I'm trying to picture me coming back from Venezuela and telling Jen, hey, I think I'm going to start doing this for charity to a certain degree.
My wife and I were both on board. That was a godsend that we both just knew that there was something we were supposed to do. And I do remember as we went through the process of working on this and setting it up and talking with people and getting support behind us, and I remember looking at her and saying, it's time to do it.
Right.
Which meant that I left my general surgery practice and working with my brother, which I love to do, and I had a pretty guaranteed, income and trajectory for our practice, which was doing well. And I was going into something that I couldn't really guarantee that we'd be open in 6 months or a year.
Right.
Can I ask you a question with
yeah.
that?
So radio listeners, that voice you hear is Jennifer Knoll, my wife, who also serves on the advisory council for Victory Health Partners. Sorry to introduce you earlier.
But that's okay. Thank you. So, Doctor, I was wondering, did you have the discussion with your wife prior to going on this trip?
Oh, yes.
Okay, so it had been kind of in the works.
It was, and we were both right on board with it. I mean, it was a path God had put us on earlier than that, and we just didn't know what all the details were.
Well, when you start looking at providing this service in Mobile, you had already done a little bit in Memphis. You'd kind of seen the demand there, but
Right.
were you still taken aback a little bit once the reality of how many people needed help came into?
I mean, when we looked, even back then, it was probably 110, 120,000 people in Mobile and Baldwin County, and my concept was that Mobile and Baldwin County would be great. But the need was even greater surrounding us, and there wasn't anything like us full time, really from New Orleans to Pensacola to Montgomery.
Right.
So, and most of our patients hear about us by word of mouth.
Right.
So it's somebody that you know, and the people we serve are people you know. There's somebody in your family. There's somebody that's sitting in the church pew next to you. There's somebody that you go get your hair done. There's somebody that needs that service.
Right.
Your hair done.
Right. Well,
Josh Knoll.
yeah. All right. So, how does the general public plays a part in this in Victory Health, not only as patients but also the community working with to assist Victory Health, right?
Right.
So let's talk a little bit about that.
The name Partners in Victory Health Partners was very purposeful because we knew that this was really look at it as a community problem, but a community answering that problem. So we don't depend on any government funds. We have no government support. So Montgomery doesn't support us. Washington doesn't support us. But this is the greater Mobile community coming to attack a problem. And it's the church, it is the faith community coming together to do what we're supposed to do.
On that, okay, so when they come together like this, I'm going to ask my wife Jennifer. So there is a thing called a change maker.
Right.
That's a community volunteer. Can you talk a little bit about that and then how that ties in with the advisory council? So, Jen, I'll ask you. You got asked to be part of the advisory council. And I'll set this up a little bit, Dr. Lightfoot. When we first got asked, and I think you've dealt with this before, so I mean this with the utmost respect, but we were a little skeptical.
Yeah.
We thought, how in the world is somebody doing that much in that manner, right? And then we met you, and kind of similar to what you said earlier, it was a little bit of an eye-opener to us. I mean, we both come from fairly blue-collar backgrounds, so we grew up in that where, even somebody working hard is at that, just on that hump where they can't get over it,
Exactly.
right? So we were pretty excited about the fact that there's actually something out there where people, it's going to come out wrong, but you can have your pride and you can come in there and get help, right?
Yeah.
So
Yeah, it's our focus is really it's a ministry first for us, and so our focus is sharing the love of God, and we joke around there that, oh, by the way, we do healthcare. Because it's really not why we're there, but we're there to love on people and take care of them and bring them to wellness and wholeness, which is what their God designs for them.
right. Jen, I'll ask you. You got asked to be on the advisory council. Sorry, I can't see you.
Yes.
The radio listeners don't mind, but the video might look funny. So, tell us a little bit about how that worked out, in case somebody's interested.
Well, when I first got asked, I did research, and first of all, there was an advisory council for Mobile, and obviously there is much awareness needed here in Baldwin County. So I was asked to be part of the Baldwin County Advisory Board to create awareness, not just awareness that, hey, if you need this service, that it's available in Mobile, but looking out for doctors, physicians, dentists, specialists, anything. We need assistance in Victory Health Partners. So if you're listening today, we'd love to hear from you, even if it's one day a month or a patient, whatever services that could be offered could change a life. So I'm very passionate about that and helping those in need, and thankfully Doctor here has provided this to us in this area, and it's huge and not known in the Baldwin County area. So I think this is great. We have him here and spreading the word.
Well, I think that teases up pretty well, because when it comes to specialists, you need all the help you can get. Right.
Right. I mean, if you don't have health insurance, it's hard enough to see a primary care doctor.
Right.
I mean, it's there, but it's hard to do.
Very expensive too.
And expensive. But to see a specialist is it's not in your budget.
Right.
Just not. So, what came forth, and this is a testament to the medical community in this area. They came forth and said, we want to help. So they said that we'll see your patients, we'll see these patients in our own office, and we'll see them for a small copay of $35 or $45 or whatever it is. And that's the next step in healthcare. That means that a patient who needs to see a cardiologist can see a cardiologist, or an orthopedist, or a podiatrist, or a chiropractor, or a physical therapist, or all those things are available from referral with us through those partnerships. And it amounts to, I don't have a number to put on it, but millions of dollars every year of donated services.
Easy. But on the flip side of that, almost every single thing you listed there were things that, if not addressed,
right,
typically get worse, not
right,
better on their own, and become incredibly more expensive or lead to long-term disability or premature death, right?
Correct. Or hospitalizations that are unneeded.
Right.
And, so to have that available for our patients and have it readily available really is a huge step in their wellness.
Love it. All right, on that note, we'll take a quick station identification break. For those of you all just joining us, this is Focus on the Five, conversations with Baldwin County, Alabama entrepreneurs and business leaders. Today we get to change that a little bit. We're Focus on the Five and Focus on the Two, because we're going to be really hitting this out on Mobile as well. I'm Josh Knoll, I'm your host, and I'm joined by Dr. Robert Lightfoot of Victory Health Partners. All right, now, Doctor, I want to jump back into, we've got a couple different lanes to run here. One, obviously, we have the general public that needs your services, right?
Right.
And I think the battle there is just getting the information out to them to let you know that you're available, right?
It's amazing how many people in this area may have heard of us, but don't really know what we are.
I couldn't agree more.
Yeah.
I mean, we were here for several years before we knew.
Right.
And then the second lane would be the general public that is in a position to help Victory Health. What kind of ways, outside of doing what Jen did with the advisory board, what are some things you see that the general public can do to help Victory Health?
Well, I mean, there's the first area is prayer. I mean, we're prayer supported, we're prayer based, and for people to pray for us is hugely important to us, and we feel those prayers. Second is volunteering. I mean, we have a very small staff for what we do, for the numbers that we see, paid staff, but we have, I think last year we had over 60,000 volunteer hours in the clinic, and that's a lot of people coming and doing their part from the front desk to the very back. Not necessarily medical, but something that allows us to be able to keep going on the small staff that we have. So volunteerism is a huge part of what we do. And a lot of our volunteers come from churches in the area or groups, or we do partner with some of the universities locally that send students that are pre-med, pre-professional students that need some experience, and so they come and get experience, but also they serve us and serve our patients.
That's a great way to kick off a career, really.
Yeah, well, I'm happy to write letters for them,
right,
because they've come and they've worked hard and they've given to these people who really need it. So volunteerism is a huge part of what we do. Gosh, we are a horrible business model. I mean, we're in the worldly sense, we make no sense at all.
Right.
Less than half of our budget comes actually from patient fees. So we have to raise $700,000-800,000 a year to maintain what we do and keep the prices low. We do everything that we can to lower prices for our patients, keep them down so that they don't end up not being able to afford even us. And that support comes from everywhere. A tremendous number of individuals. Change makers is a great way to get into that. Change makers are people who have agreed to donate on a monthly basis as low as $25.
Right.
Just give up a lunch or some coffees for the month and donate it. But they also become ambassadors, just like your wife, that are out there speaking about who we are and what we are. And then we're supported by local churches, a good number of local and some statewide foundations, and corporations in the area. So there's a lot of well-diversified support. We are a United Way agency in Mobile and a couple other counties, which is a very nice part of our budget, but not a huge part. But that's also a great partnership because we partner with all their agencies, and what we can't do for somebody, we know there's somebody that can. So that's a huge part as well.
What about in-kind donations?
In-kind is huge to us. We're the only place that gets really excited about toilet paper. And,
You and the Knoll household.
and coffee. I go personally meet anybody that brings Dunkin' Donuts coffee to me. But it's also little things like that, copy paper. I mean, just simple things that small groups can do, individuals can do, and that takes that off our budget for us to be able to
It
do
adds
that.
up.
No, it's huge every year.
What do you, I wanted to ask you this before we get into your large annual fundraiser, but I know we've touched on faith a little bit, but why did you feel it was important to be a faith-based organization?
When you look at healthcare through history, the faith community has been healthcare. You can go all the way back to as far as you want to go back, but the Middle Ages, during the plague, the only people that stayed around were the Christians and the Jews, and they stayed to help the people. And from that, healthcare has always been faith-based, and I believe we're really commanded to do that. The Bible says we're to take care of the poor, the sick, and the widowed. And so it's part of what we're supposed to be doing. And unfortunately, as Medicare came around, insurance became big, and government got involved, it became big business. And the church and the faith community, not completely, but for the most part, took a step back.
Right. Or got swallowed up.
Got swallowed up in business part of it. And so, it's part of what we do as a small part is reclaiming what our faith says we should do. And therefore, for us, that's part of the reason it's a ministry first.
Oh, that's great. So we've got, you said about half of your budget comes from the various fees that you collect, and roughly half comes from donations, fundraisers, things like that. Well, you've got your big fundraiser coming up.
Yeah,
is that right?
We only do one major fundraiser a year.
And when you do it right.
Well, it's a big deal.
Yeah,
We've been doing it for a lot of years.
So Hope for Healing.
Hope for Healing
Let's talk about it.
Is a celebration. It's not a banquet. It's a celebration of the goodness of God and the testimony of God. And during the celebration, we have patient testimonies, we have videos, and we've always been blessed with incredible speakers through the years. But this year we've kind of jumped out and gone big.
You went big.
Went big, and Drew Brees will be our speaker in May 19th this year for Hope for Healing.
So you all reached out to him, and I'm going to assume you don't just call or text Drew Brees and say, hey, come talk.
I do not have his number. But Kim Garrett, our director, reached out through his people and just said, here we are. This is who we are. And his folks got back with us and said, oh, we would be very happy to do that. We'll be there. And so it got arranged very quickly.
Well, so let's talk about the actual event. So the event is called Hope for Healing, right? And it's going to be held on Tuesday, May 19th at the Arthur Outlaw Convention Center there on Water Street. Is that correct?
Correct.
All right. The event's in the afternoon. Excuse me. And I know you can get tickets to the event. You can have dinner and the event. And so I'll let you take it from there.
Well, I mean, with Drew Brees, we knew that we'd be hitting a lot different or a lot bigger population and people that might be interested. So there's all sorts of ways that you can come. And really to investigate or to ask about tickets or whatever, you simply can call the clinic and we can get that arranged. Or our website, victoryhealth.org, has information on it about how to get tickets.
And the Facebook page.
And Facebook page, and I'm sure they do Twitter and all those other things too that I don't get involved in. But
Miss Kim Garrett.
Miss Kim Garrett takes care of all that.
Yeah, we were, for those watching the video, we'll give a little shout out to, what role does Kim have in your
Kim is the
organization?
director of Victory Health Partners.
And she was kind of what tied us all together.
Right.
And she is currently right now about ready to have a baby.
Yeah,
Yes.
any moment.
She's sitting right here
Yeah,
next
she-
to him, but I get to be the fill-in
Yes.
for her today. So thanks, Kim.
So
there are a lot of different options of tickets if you just want to come hear Drew Brees, for the dinner itself, which will be an incredible dinner. There are sponsorships available for all levels, all different things, tables for sale, all those type things. We did have a special ticket where you had a chance to be with Drew Brees and actually get a picture with him and whatever, and that sold out very quickly.
Yeah, probably in a matter of hours.
So we actually had to shut that one down a little bit, but he will be there the whole night and be speaking.
Well, on your website is victoryhealthpartners.org.
.org.
Right. ORG. I will tell you that part of it, the Hope for Healing section, is very easy to follow.
Right.
And you've got two main choices. You can come as a participant, or you can come as a sponsor.
Right.
And then it lays out the different ticket prices and the
Right,
sponsorship
and what
opportunities.
comes with the sponsorships and all that.
Okay. Well, on that note then, how do people contact Victory Health Partners?
It's as simple as our website. Even patients can go on our website, or potential patients, and go through the qualification process and see what they need and how to do that. You can call our clinic. It's 251, of course, 460-0999. And that number will get you appointments, or to the volunteer people, or for tickets for the banquet. And also, of course, Facebook and all those other things.
Snapface.
Snapface. And
Dr. Lightfoot,
Twitter.
can I add something?
Yes.
So one thing, if you're looking from the patient side of it, everything, once they arrive, all the paperwork is handled the day of, and they're
Right.
process.
One thing that we do, we do try to qualify our patients, which is very simple. I mean, it's just a little bit of information. And part of that is what their taxes are and all that. And that becomes important, not just for us to set whatever their copay is, but one of the biggest things that we do is through patient assistance programs of the pharmaceutical companies, we get free medicines for patients. And last year we ordered and dispensed over $39.4 million worth of medicines through those programs. So we do need some information to do that. So there is some simple things. But once a patient calls, we can usually qualify them, see them the same day. We see new patients fairly quickly. We do see some walk-ins and folks that are just sick and just need to be seen. We try to see as many as we can.
Very good. And the website is victoryhealth.org.
Victoryhealth.org.
Yeah, that's my fault. I put
Yeah.
the partners on there, but victoryhealth.org. All right, I have two more quick things. Is there any particular physician specialty that really has a pressing need right now?
Probably three areas that we're low on or have a hard time is gastroenterologists,
Okay.
ENT, ear, nose, and throat doctors, and ophthalmologists. And those areas are ones where any help would be tremendously appreciated. But when you look at it, the more people, more doctors and their offices we have involved, the more we spread it out, and the more we're able to get people. For instance, in Baldwin County, to be able to get somebody to see somebody in Baldwin County
Right.
would be outstanding.
Right. Well, because I mean, here in Fairhope, you can get a little bit of a different feeling. I mean, not all Baldwin County is like this. I mean, it gets, people need help here too.
Yeah,
Right.
there's a tremendous number in this county.
I agree. All right, I got one last thing. I think I've got a good enough feel on you. I can take this little leap of faith here, but you seem to be somebody that made a decision when you started Victory Health Partners that you're going to not only lead an intentional life in helping people, but you're going to lead a life that wasn't about you anymore, right?
I appreciate that.
All
Thank
right.
you.
So on that path, then there's been people that have been crucial to your success.
Yeah.
I don't know if you've ever had an opportunity to say thank you to them, or if
Oh,
there's
wow.
anybody in particular. I know the list would be long. I often
It
joke,
would
I tell
be.
her, I was like, I can't win an award because I'm going to do 2 hours
I
of
would.
people.
That would be a thank you for a half an hour.
But let's go back to the beginning. There was a couple people that, if they
Yeah.
weren't there at the right time, things might have gone different. Is that fair?
Absolutely. I think I can go back to my family. I can go back. My father was a physician. I'm a fourth generation physician, so my great grandfather and my grandfather, and they practiced medicine. I'm probably doing as close to practicing medicine as they did, seeing whoever wanted to come when they could. My brother Bill and John, both doctors, strong influence in our life. And of course my mother, who raised 3 boys and sits next to Jesus in heaven now because she raised these 3 boys. I had a lot of good mentors through medical school and training in general surgery. Probably the pivotal point for my wife Tammy and I was in our faith walk was in 1997. We went to the Brownsville Revival in Pensacola, and it was a radical change for us. It was a lordship moment. Jesus had been our Savior, but he wasn't the Lord of our lives, and we really at that point submitted and surrendered our lives to whatever he wanted to do. And along that path, we've had incredible pastors and people that have walked us along that path. And, when you surrender to Jesus and you give it all to him, he'll take you places where you'd never expect.
That's right. I like to joke a little bit, but make God laugh, tell him your plans.
That's right. My plans didn't go very far.
All right. Well, Jen, do you have anything else?
Just that if you're listening, please reach out for Victory Health Partners. We'd love the assistance, more doctors, more volunteers at any level, or donations. Like Dr. Lightfoot said, coffee from Dunkin' Donuts is awesome.
Well, I think one area you and I can really help around here is, the Hope for Healing is, it's Drew Brees. Come on, right?
Yeah.
I mean, that's so
it'll be a great night.
And it's going to be a great night. And you've got a great website. You've got ability to sell those tickets. I think one of the things that Jen and I have around here is connection to people that can provide services. So if you're interested in kind of learning a little bit more, reach out especially to Jen, and we can kind of start that conversation on that. So, all right, Dr. Lightfoot, anything last thing for a close up?
No, thank you very much for having us and having me and being able to speak about something that's a real passion for me.
Well, you're doing a great job. Well, if you're a regular listener to the show, then you know that we also film our conversation and release it on YouTube, Facebook, and my website, gulfcoastfa.com. So if you're watching this video and like to reach out to either Dr. Lightfoot or myself, just send us a message. And I always say, remember to support local because the local supports you. Boy, that is really true in your situation.
Amen.
Yes.
Amen.
Yeah. Okay. In closing, I want to thank my guest, Dr. Robert Lightfoot of Victory Health Partners, for joining us today. You did a great job. Also thank our producer, Miss Lori DeBose. She's the one you saw at the beginning of the video. Thank my wife, Jennifer Knoll, for coming in and bringing the energy and the spunk. And as well as all you out there that are listening, I am Josh Knoll of Gulf Coast Financial Advisors, and this has been Focus on the Five. Thank you and have a great day.
Thank you.
All right.
Thank you for listening to Focus on the Five. If you are interested in learning more about Josh Knoll and Gulf Coast Financial Advisors, you can find us at gulfcoastfa.com, call 251-327-2124, email josh.knoll@gulfcoastfa.com, or message us on Facebook.
Advisory services offered through Prime Capital Investment Advisors, LLC, PCIA, a federally registered investment advisor. PCIA, doing business as Prime Capital Wealth Management, and Qualified Plan Advisors. PCIA and Gulf Coast Financial Advisors are not affiliated. All information presented is for educational purposes only and is not an offer or solicitation for the sale or purchase of any securities.